Talking about this new initiative of yours, something called COGUK, which I want to find out a lot about. What is COGUK? What's the concept behind it?
Okay, well, the concept really started through some years of my career and meeting many other allied healthcare professionals and realizing that many healthcare professionals don't know a great deal about what each other does in their practice terms or in the way they operate. And that's pretty well similar across the board. And in the same vein, having met lots of patients who arrive at the practice over the years who've got problems and pains and difficulties where they may have heard or tried lots of different people and they want some approach that might do some good and try and help. It's not that we can fix everything, but they want someone who's going to go into that kind of detail. And quite often, the missing gaps are the bits where patients have been passed around or found other healthcare professionals but not had the links in the background between those professionals to kind of get the best way forward for them.
So it's really a linking together of different professionals in a cohesive approach.
Yeah, and taking on board what the communities want and need. We actually did a project which got published by the Royal Society of Public Health online as some help desks we did actually at Westminster Library Service. And they actually looked at people just wandering in and chatting to us about their problems. We had a help desk set up. And we got quite some good case studies, really, from people who were very much lost and not sure what to do, who were suffering of all different ages. I mean, it was, literally, we even had a child who came in who had been self-medicating paracetamol. We had, older people who had problems with their lower limbs and knees. And we had a chap with 3 children who was a waiter who, again, had all sorts of trouble he didn't know what to do about. So, a lot of people out there are not knowing what to do and how to access care. So it's a bit of the two, as you said, marrying up the cogs, literally, between the population and the healthcare professionals.
Wow, so who do you hope is going to come together in this particular initiative? Is it just osteopaths, or do you reckon a whole load of other people as well?
Well, actually, funny enough, I did a webinar last night, and we're talking about innovation and adaptation with students of health across all of health. So they were on the call last night asking questions, and we talked about it a bit then. So it is actually open to healthcare students. It's open to other healthcare professionals. It's certainly not all about osteopaths. In fact, really the need for all of us to talk to each other is greatly apparent in the current crisis. It's something that would help make us manage, in a sense, and adapt more quickly when we know how others work. So that's kind of driven it. And in fact, I think also patient groups, it would be great to get them on board, because we're actually hoping to sort of build together some telehealth support for link workers and people who are carers looking after families, and even get that funded in the longer term as well. So we're speaking to a lot of people at the moment, and it's quite a lot. I'm glad in some senses I've got the time at the moment to be, webinaring and talking to people quite a lot of the time at the moment.
Yeah. So what will this initiative bring to the patients? Or what will it bring to healthcare that isn't there at the moment?
Well, it's shortening that journey, shortening the route, and having a more defined signposting, really. That leaves, it leaves people less at a dead end. I think, and people stay at that dead end for many years until they happen across a recommendation, rather than actually being directed a little bit sooner to find someone who might be able to help them. And it's a huge, shame that this happens so often. There are also lots of people like drama therapists and art therapists and all sorts of people who are doing great work with all sorts of age groups, from the old to the young. And again, people just don't really know and understand and appreciate all of that kind of work that goes on. So, I think there's a massive amount of learning to be done. I mean, at the moment, I'm actually coaching a paramedic who is from London, and it's very interesting just looking at all the crossover areas and areas that we can all, as healthcare professionals, improve upon. And that's just encouraging me to stay on track with COGUK.
Right, so this coaching aspect, I didn't know you did this coaching aspect, Robin. It's interesting. Have you discovered anything? Have you observed anything else in the people that you've been coached that's helped you in forming COGUK?
Well, yeah. I mean, I think coaching is, although one is offering one that help and direction and so on for them to develop themselves. Certainly, the questions that one gets back are useful, and their observations in their own communities have sort of informed me about a lot of the things. And particularly, it does come down into what's called the silos of healthcare. So how things get into a particular barriers between professions. I mean, they're sort of invisible barriers, but they're nevertheless are there, and that's a shame. I mean, anyone will know when one's perhaps got an elderly relative that you're looking after and perhaps want to try and get a particular route of care, or you don't know which way to take them. It's very laborious and very time-consuming, really, to get people to where they need to get to, and it's easy to feel you can just give up, actually. And I think that's pretty common to a lot of people in lots of areas of health,
right.
which is very sad, especially as we talk about the current situation. It's the NHS is doing a great job to rally around, and people are making the best of everything that can be possible to make the best of. And I think that will be something to carry forwards, really, beyond these times. That is the way we're set, in a sense, rather than having to adapt.
Yeah, obviously what we're in now is a temporary state, but do you think that what you're doing in COGUK is designed to maybe improve the entire patient journey? Has the patient journey changed in the past 20 years or so? Has it become tougher for a patient to get the particular linkage between the different professionals that they need? So is that the issue that you're trying to address here?
Well, I think it is. It's the most appropriate care for them. It is finding the right person, but it's also doing that in the most timely manner.
Right.
Suffering is, saved. The time of suffering is saved. So either way, I think that's something for the future beyond, as I say, the current situation. I think over the years, sadly, the conversations we still have with patients who are in a lot of pain, who come in for the first time, who've been persuaded by perhaps a friend or relation, or sometimes a healthcare professional to come. They've had to be persuaded because they just don't know what to do, and they've been left really feeling demoralised.
Right.
And when they come and they get some help, they're kind of going, "What on earth? Why didn't this happen sooner?" And that's something that I've seen over the years. And I don't know, is it getting better? I think with health services getting more stretched and GPs getting more stretched, I think perhaps that area is not necessarily getting easier.
So we're talking about COGUK and the benefits that you hope that will bring to patients and to, I guess, to healthcare professionals as well, isn't it? So,
Yeah.
we talk about healthcare professionals as well, but also are there particular people in the community that you don't think they get the care that they need the most, and how can we help them access the best help?
Well, it's really about kind of navigation. So families and carers who are looking after people are struggling sometimes to get that sort of what's called healthcare navigation, so to try and work through the system to find out what's best for them. Obviously, GPs are often a focus, but if you can't see the GP, or perhaps the GP is not around or whatever, it can be really tough sometimes to know what to do. And even then, you may have been signposted and things have been tried, but not everything or different options have been explored for the individual. So I think that's what this is about. It's kind of opening doors and giving people choices and options, more than ever, really, to try and get the right thing for them.
Right, final point, I guess, is to get people to look at you and find out more about what COGUK is doing. Do you have a website or something similar people can look at?
Well, we do, because actually, for anyone who's a health professional, in the Berkshire, Buckinghamshire area, then, or anyone in the country for that matter, but nevertheless in the local area, by all means have a look at COGUK.info, COGUK.info, and that will tell you more about the project. And if you want to sign up at least to get more information, then please do as a health professional. Health students as well can, if anyone's studying a health discipline that's going to be allied health connected, NHS connected perhaps, then also for them.
Robin, thank you so much for being my guest today.